Good afternoon, everyone. Today is Thursday, June 27th, 2024. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to today's General Ledger Collection Template Training and Technical Assistance webinar. On the panel today, we have Elizabeth Peters, DDA Special Assistant, and Kristen Deal of the Hilltop Institute. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone, and if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has been uploaded as an attachment and is available for you to download in the webinar panel box. If you are listening by phone, you can request that it be emailed. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Elizabeth Peters. Good afternoon, Elizabeth.
Good afternoon, Donna, and thank you so much, everyone. On behalf of Maryland's Developmental Disabilities Administration, I'd like to welcome everyone to today's General Ledger Collection Template Training and Technical Assistance webinar. We really appreciate you taking the time out of your busy days to join, and also would like to thank our partners at the Hilltop Institute for joining us today. And with that, I will turn it over to Kristen from Hilltop to kick us off.
Hey, thanks, Elizabeth. Good afternoon, everyone. My name is Kristen Deal. I'm the Director of the Aging and Disability Studies team at the Hilltop Institute, and we are working with DDA to collect General Ledger template from all of the DDA providers. And thank you again for joining us this afternoon. I want to give you a quick overview of our time we'll spend together today. We are going to start with an overview of the template, talk through the instructions, talk through selecting the right cost category and where things should be put on the template. We have an example template that we can walk through where we like to share some frequently asked questions that have come up as we've been providing ongoing technical assistance to the provider community. We will talk about how to submit your template when it's due in September, and then we'll have a slide with some resources, and we'll close with a Q&A session for any questions that you might have after listening to our explanations today. Next slide, please. Okay, and just a quick reminder for everyone, the General Ledger template is serving as the long-term data strategy for DDA. And so really this is the opportunity to collect cost and expenditure information from the community to support a data-driven rate review process. All DDA providers are required to submit the General Ledger template, and we will be collecting that data due on September 30th for fiscal 2024. There were no new data elements added to the General Ledger template that we shared last spring. So we've been doing some updated trainings just to remind the provider community and answer any ongoing questions as you work to collect that data. And we have shared the link in this slide for where you can find all of the documents and resources. You can find the template, the instructions, example template, and all of the recordings for our technical assistance sessions. Next slide, please. Okay, and I am going to hand it over to my colleague, Elizabeth Blake. She is going to provide an overview of the template, walk through the instructions, and then also share a sample template and walk through how costs can be added when you're filling out your templates with your data.
Thanks, Kristen. Are you able to see my screen with the PDF document?
Yes.
Okay, perfect. So, hi everybody, my name is Elizabeth Blake and I'm with the Hilltop Institute. And like Kristen said, my goal today is to walk you through all of the documents that we have posted on DDA's website to help you complete your General Ledger template. So I'm going to review the instructions, the GL template, as well as an example template walkthrough. So DDA is requiring all DDA providers to collect and submit general ledger cost data to inform rates for DDA, Medicaid, traditional waiver, and targeted case management services. So the overall purpose of this template is to support providers in submitting data consistently across the system on an annual basis. So this is just to ensure that the rates are data driven. So the GL template was originally sent to providers by DDA in May of last year. And this was done just to give providers time to make sure any needed updates that they needed to make to their accounting systems, they would have time to complete that. So we have done some minor edits to the general ledger template, but overall, the way that the data is collected has not changed. But as we've become more familiar with the template, as well as talking to providers who have been really great at providing feedback for us, we've been able to kind of improve the template itself and make it a little bit more user-friendly. So in our general ledger template, which I'll pull up in a minute, some of the changes that we've made is we have taken away the instructions tab in the general ledger template and just put a background tab. So now we just have this separate instructions document that I've pulled up on the screen. And again, like I said, this can be found on DDA's website, along with all of the other documents that I've showed today. So the content of this instructions document hasn't changed, but we have really made a lot of effort to increase the usability for providers by creating separate sections so that providers can more easily find what they are looking for when they're completing their template. So now the sections that we have is we have the purpose of the general ledger data collection template, DDA Medicaid data to be collected. And then we have helpful information on the template format, completing the template, just the general instructions. And then we also have more specific instructions related to the different services. So that's kind of the new format of this. Some things that have not changed is we still have our crosswalk of general service categories with the specific services here. And this is also in your general ledger template, which I'll show you. We have attached the attestation form that you will need to fill out and upload when you submit your general ledger template, which I will talk more about when I talk about how we need to submit the template. We have our cost categories defined here, and this is also in your general ledger template as well. And then we've also just kind of given you an example cost breakdown for the, or example cost category breakdown for different line items that you may see in your general ledger template when you are completing it. So I'm going to scroll back up to the top here. And I'm just going to highlight some important parts of this that may be helpful for you to definitely look over. So the first thing is the DDA Medicaid data to be collected. So the data that we're asking for, we are asking for you all to provide it to us by cost categories for the services that your organization is providing. So we also wanted to make sure that we highlighted that this is capturing both billable and non-billable time. So cost category data points include the accounting code, the description of the code, and the expenses associated with that code. So because providers all have different accounting codes or accounting systems, your accounting codes are most likely not going to be standard across different organizations, which is why we're asking for you to provide us with the description of that code. So it's going to be really important for us as reviewers. When we're looking at your templates, we need to know exactly what cost or line item is being included in the cost categories. So that description is going to be super important. We're also collecting the service units and the total Medicaid payments received, which is going to be all the way at the right side of each service tab, which we will go over. So we also have some helpful information on the template format, and just some things to highlight in this section are that the instructions will tell you anytime that we're asking for a data point to be collected, the cell that you will enter it into is going to be colored gray. So whenever you need to enter data, it's going to go into a gray cell. We also wanted to note that you should not be deleting any rows or any columns from the general ledger template. However, if there are not enough rows for you to enter your line items for each cost category, then you may enter additional rows, and we kind of provide some instructions on how to do that. So as long as you're entering your new rows above the pink total rows, we shouldn't have any issues with the formatting. So then we have our general instructions just for completing the template. So this will note items needed for the provider information tab, which I will show you, and I'll pull that up so that we can talk through those items. It also provides details on data points that will be collected across all the services. So something of note is that providers should be entering the number of hours associated with accounting codes for DSPs, employment-related expenses, program support, training, and transportation. So this is kind of a new element in the template that I will show you when I pull it up. So the hours for ERE, program support, training, and transportation are going to be non-billable hours, and are just those that are associated with the DSPs. So these hours are related to the wages entered in the different cost categories, and there may not be hours associated with all of the costs, which is evident when we look at the example template. So for any providers who filled out the general ledger supplemental template in the spring, this is essentially the same process as completing that productivity factor table, except for it's no longer a separate table and everything is being completed up at the top of the template. So we also just have the crosswalk of the general services. So again, like I said, this is the same thing as what is in the template in your background information tab. And then of course, that attestation form that I have pointed out, this is a copy of this is also on DDA's website, and a signed attestation form is going to need to be included with your template submission, and it will have to be uploaded as a PDF. So my advice would be to download it from DDA's website. And then of course we have our cost categories defined, which is just the exact same thing that is in the actual template itself. So now I'm going to pull up the overall general ledger data template, and I'm hoping that you can see this Excel document that is the general ledger template, but I'm just going to keep going. So like I said, we have switched from an instructions tab to a background tab. So now the instructions, the only place that those are in that PDF that I just shared with you. And it's also posted on DDA's website, but we still have the crosswalk of the services here for each tab. So the provider information tab, so this tab includes organization information at the top, as well as details regarding cost allocation methods for each cost category, the number of DSPs employed by level, the average hourly wage for DSPs by level, staffing patterns of DSPs providing services, and it also contains this summary of tasks completed, which is something that will auto-populate based on whether or not you've put any type of information in any of the tabs. We've also given you some space to provide us with feedback on the template itself. And we've also given you a space to tell us a little bit more about your cost allocation methodologies. So we're asking for you to provide this cost allocation methodology by cost category. And when you do that, if you have additional details that would help us as a reviewer understand this method that you're using, this is where they should go. And in the example template, I will show you that we have completed that as well. So like I said, cost categories defined tab. This is the same document that is in your instructions document, but we also have it here for you to easily flip back and forth. So we have our direct care staff, and this is where the costs are going to go for all staff that provide traditional waiver services directly to participants. And then we have our employment related expenses, and this is where you'll enter the costs, the other costs incurred in employment of all staff. And it's really important to kind of highlight this fact that it is all staff here. That's something that's come up, which we'll talk about in the frequently asked questions, as well as in the example template. And then we have program support. And program support is the cost required to provide the service, so the wages and goods specific to the program, not directly providing the service. And then we have facility, and this is the cost for running a facility where the services
Elizabeth, if you're still speaking, we can't hear you on our end.
Hi, this is Kristen at Hilltop. We're having some technical difficulties. I can take over for Elizabeth, but I'll need to, I guess, have access to share my screen since she was sharing the template.
Thank you, Kristen. I'll give you your presenter invite. You can see your screen. Kristen, I don't know if you're speaking, but we can't hear you.
Okay, you can see my screen and it's on sharing the template.
Yes, thank you.
Okay, perfect, thank you. Okay, apologies everyone. I can pick up where Elizabeth left off, and I believe she was talking through the cost category descriptions, and she had mentioned that these are the same descriptions that you'll find in the instructions document. And you can see that it's listed by cost category, aligned with how you will want to categorize costs within the template. And so you can see each of the different cost categories, and there'll be examples of information that you should include for that cost category and items to exclude, and often when it's identified as to exclude, where that cost should be put in the template. So this really will be your resource document for making sure that you're being consistent with where you're entering all of the costs on the template. And so then if the template also includes a tab for each of the services that is available for you to enter. And so the name of the service is at the top of each tab, and then you can see that there is room under each of the cost categories across the top. And there are two sets you'll see here. One is for if you provide services in the rest of state or in the geographic differential. And so you'll want to split those costs out accordingly. You'll see there's lots of gray shaded cells, which were highlighted as where you should add data. If you need to add a line to the template, you'll want to add it within the gray cells, because on the pink cells here at the bottom, it will be totaling for you. So there's all of the different cost categories to enter your data. And if you scroll all the way over to the right, you'll see where you'll add information on payments and utilization. And so this will be split out based on whether you can provide services in LTSS Maryland and or PCIS2. And so you'll see it is asking you for the total units as well as the total reimbursement received for services. And so again, it's broken out by rest of state and geographic differential. As you're entering information into the template, it will total for you in the cells. One other thing to note is that on each of the tabs all the way at the bottom on the left side, there will be information to collect on the number of individuals you serve. In this case, it's asking for the number of sites, your approved capacity, and the number of unduplicated participants served annually. And so this is where you would enter that information for us. There's also a box for you to enter any notes to the reviewer. So if there's any nuances to your data, assumptions that you made, or anything that you'd want to flag as we're reviewing that cost data, that information can be added in the bottom here. And so you'll see across the bottom of the document, there are many different tabs. And so you'll see there's pink for residential services. As you scroll over, you can see there are gray tabs for all of the meaningful day services. And so these tabs all look very similar. You'll see the name of the service at the top, a little explanation. We can just take a quick peek at the bottom. And so this is a different data point we're collecting on the participant served. So you can see it there. And again, the note to reviewers. As you continue to scroll over, you'll see all of the support services. Again, the template looks consistent across with the cost categories and the utilization and expenditures. There's the number of unduplicated participants at the bottom. And then finally, if you are a targeted case management agency, this last tab is for you. It also looks very similar, and there is a different set of distinct questions at the bottom. We're looking to collect from your organizations, and then again, any notes to the reviewer. as you fill out the tabs, if you go back to the provider information tab, once you have entered data into a tab, it will populate in here. So when you're finished completing tabs, you can do a double check that you have entered data into the tab for every single service that you provide. And so it will transition to yes once there is any data entered into the tab. And that's a great way to double check that you've provided all the information that we're requesting. Give me 1 minute and I will see if I can pull up the example template. Okay, so this is an example template that we have put together to just give you an opportunity to see where different costs should be added for different services. And so again, here is the provider information tab. And you can see we've included the information for our organization, along with the Medicaid number for LTSS Maryland, along with PCIS2. We've received lots of questions about how to allocate time or the allocation methodologies. And so this template example has been set up based on a percentage of time. So as we're looking across, you can keep in mind that the allocation was based on percentage of time. And then we're again collecting information about the number of employees, and we've added the wage in here, the hours worked, opportunity to provide feedback, and you can see that our summary of tabs completed has transitioned to yes because we've added data in those templates. So this cost category is defined is the same tab that you'll see in your template. And then we have added data to this meaningful day services with a staffing ratio of 1:1. And so to do a quick run through, you can see that we've added the DSP wages in our direct care staff cost category. So we've added hours as well as the expenses across the two different payment systems. When we're looking at employment related expenses, you can see we've added wages for paid time off, wages for bonuses, wages for overtime. So these are the overtime portion of the DSP wages, tax information, insurance, fringe benefits, and staff appreciation. As you can see across, those are applicable. We added the hours that are related to the wages for the DSPs, as well as the expense amount. When we get to facility, we've added the wages for facility staff, insurance, utilities, phone and internet, interest improvement payments, and then R&M general. And oh goodness. And so again, this would be all of the costs related to the facility. And so same for program support. We've used our cost category definitions to add all the information in program support. So wages, again, would be for the program support staff. And the DSP wages go in the DSP direct care staff cost category. And so these would be all of the costs of providing the services under program support. Again, we've added the hours where the wages are there, and then the expense amount across each of the two categories. For training, we have the wages here. So these wages, again, are for the DSPs attending training, and this is based on the proportion of the time for that staff and the hours and the costs. Then we have transportation. Again, coinciding with what's in the cost categories. General administration, so you can see all the costs that we've added under G&A, aligning with what's in the cost category tab. But this is a great way for you to kind of reference the different types of costs that should be added in there. And then finally, we have the payments utilization. And so you can see we've added the units associated with the payments and the payment received across each of the systems. And as we scroll down, you can see that the totals are added for us within the template. So that will automatically be calculated for you. And you can see we've added the information here about the staffing ratio as well as the other data points. And so we've added similar information across the other service tabs as well. And so this template will be available for you to view on the website. And so we encourage you to take a peek and can follow up with any questions that you might have, but it's a good example of how the costs can be allocated based on time and what costs should go in the different categories. Donna, can we go back to the PowerPoint?
Yes.
Thank you. Now we'd like to talk to some frequently asked questions that have come up. We did collect data from rehabilitation providers this spring in a general ledger supplement. And so we wanted to share some frequently asked questions and the guidance that we shared this spring as we worked with providers. Next slide, please. Okay, so the first, can we go back one?
At 6, is that right?
Yes, this one's right. Thank you. So the first common question we had was about the cost category for adding fringe benefits for the different types of staff. So this would be for your DSPs, your supervisors, your administrators, and other staff for your organization. And so we wanted to clarify that fringe benefits for all employees should be reported in the employment-related expenses cost category. So this covers the costs incurred in the employment of all of your staff. The next common question we got was about the cost category for adding PTO and the overtime portion of the overtime wages for different types of staff. So for DSPs, supervisors, administrators. So again, the PTO, OT, and portion of the OT wages should only be reported in the employment-related expenses cost category. Next slide, please. Okay, this question talks about how to separate out DSP time for those who provide direct care for multiple services. And so this gets to using a cost allocation method. And so we provided a simple example of using the percentage of a DSP time who provides services in multiple services for your organization. So you can see we have an example of a DSP who would provide services in your DayHab one-to-one groups, your DayHab small groups, and your DayHab large groups. And so the wages and the time are based on the percentage or the allocation that they spend with each of those different services. So if you take your total hours and your total wages and your total PTO accrued, you can see that by using a percentage of the time, you can provide the wages and the time and the PTO across each of the different services, based on that percentage of allocation. Next slide, please. As we wait for the next slide, what we're going to walk through next is how to submit your general ledger template. And so when the slide comes up, we'll see that there is a submission link. And so this will be where you can click to submit your template through Qualtrics. And so this link will open on July 1st, and this will coincide with the end of the fiscal year, so that you make sure you have all of the data that you need to submit for 2024. And so if you do click on the link in advance, it will just give you a reminder that the link will open on the 1st, and that all data should be incorporated. We do want to flag that we're not taking any email submissions of your general ledger templates, and this is due to Hilltop following CMS's cell suppression policy. There's the potential for your organization to have small numbers of participants reported, in those bottom left-hand, data points that we've asked for to get information about the number of individuals that you're serving, and those different data points. And so based on that, we will not be accepting any email submissions. All templates should be submitted through Qualtrics. And so we can walk through a few slides that will show screenshots of what the submission process will look like. Next slide, please. Are we able to get to the next slide? There we go. Perfect. So this is a quick reminder of what you'll see if you were to click the link prior to next week. So just a reminder that we're collecting data starting on the 1st, and a reminder of the small cell suppression policy, and not to email your templates. Next slide. So starting next week, this will be the information that you'll see when you click the link. And so it's a reminder that we're not taking any email documents, that you'll need to complete all of the fields as you see them in the submission form. And if you have any questions, you can email us at the email address listed on the bottom. Next slide. The form, when you submit, will ask for your provider organization name and your provider Medicaid numbers. So we have had some questions. If you have more than one Medicaid number, we would ask that you include all of those numbers in this submission. We'll ask that you give us the name of the information person submitting the template in case we have any questions or need to reach back out. Next slide, please. And this will be where you will drop and upload your files in the form. So there's the top you can see is where we'll request your completed GL template. In order to submit, you must attach an Excel file. And then the bottom is where you will drop and upload your signed attestation form. And so this must be a PDF in order to be uploaded. And there is a link to get to that form if you need that for reference. Next slide. Next slide. Oh, this is where we will ask that you sign, attesting to the accuracy and of the submission that you sent. So this is where you will just sign and then hit next. Next slide, please. So once you sign and hit next, this will pop up on your screen. This is a confirmation of your submission. And so we ask that you make a copy of this for your records. If you have any questions regarding your submission, you can reach out to the Hilltop DDA rate team. Next slide. This slide provides you links with all of some key information. So again, if you have any questions or need technical assistance required with your GL template, submissions, clarifications on where different costs should go, the Hilltop team is happy to schedule one-on-one time with you, respond via email, get on a phone call, whatever we can do to help provide technical assistance as you complete your template. Please reach out to us at the email listed on the screen. There's a link to all of the recordings of the training sessions. And so you can see past sessions, frequently asked questions, document, instructions, template, example template are all available on that link. And then again, just a reminder that all templates should be submitted via Qualtrics at the link below. And then the key date to remember is September 30th. We are requesting that you submit your template by September 30th. If you would like to submit earlier and have the Hilltop team review and work with you, we're happy to, again, provide any technical assistance needed to get your templates in by September 30th. And with that, I know we have a few minutes left. We can move on to any questions that you may have.
Thank you, Kristen. Can you hear me okay?
Yes.
Okay, great. Just want to make sure, since we're having some technical difficulties, I will go to some of the questions that we have posted here. The first one is for LTSS system services. Can you provide a crosswalk of the W codes to the tabs they should be included on?
That is a great question. We can work to provide that crosswalk, yes.
Okay. And then the next question is, when there are changes to the instructions, can you help us identify what the changes are by showing the changes in a bold red or highlight in a different color?
Yes. There is currently an instructions document posted. And so any changes that are made to that document, we can certainly put in track changes in the future.
Okay. Let's see. Next question is, we have PCIS and LTSS services. In PCIS, there is only one day category, but LTSS has multiple categories. Where do we put the PCIS day data?
So it should be aligned as closely as possible with the title of the day service. And you can see in the tabs on the template that there are some tabs that include both LTSS and PCIS2 data points. And so you would want to make sure you add it where the PCIS2 option is available. I would say if there's specific questions or clarifications, if you send us an email, we'd be happy to talk about the services that you provide and which tab they should be placed on.
Okay. The next question is asking, what were the red tabs again? Can you specify which tabs you're specifically mentioning? Give us a follow-up question in there to let us know which ones you're referencing, as there's multiple red tabs. Just help us give us a little bit more context to your question.
Brianna, I can try real quick. I think in the general ledger template, the red tabs along the bottom are for all the residential services. But if there's other questions, happy to provide more clarification.
Okay. We'll see if we'll get a follow-up to that one. And next question is, just to confirm, this GL submission replaces cost report, correct?
That is a question I'll defer to the DDA team.
Thanks, Brianna. Can you repeat that question one more time for DDA?
Yeah, so the question is basically, is the GL template submission, does that replace the cost report?
So we can take that back and update folks with the answer to that question, but this will be mandatory to be completed by September 30th.
Okay. All right, next question is, how are individual support services classified? Do we include that as part of the PCIS2 information, or is that considered a state-funded service?
That's a great question, and we may need a little more information just to clarify, because this template should be collecting data for the Medicaid funded services. We're not collecting any state funded services cost data at this time. So if you're being provided Medicaid reimbursements for individual support services, they should be included in the template.
Okay. Next question is, DCM provider agencies do not have DSP. Could you show us how you completed the T1 TCM LTSS tab?
Yes, so for target case management for the CCS agencies, your actual case managers or your coordinators of community services would be considered your direct service workers. And so that's where you would enter their wages and hours. Similar for some of the support services. So if it's a nurse or a behavioral health specialist who is providing the direct services, those would be considered your direct service providers. I will note that we're hoping to provide some more direct trainings for the CCS agencies. We realize that your tab and the way you provide services is a little different. So we're hoping to be able to provide some targeted technical assistance, but we would also be happy to schedule time with the individual agencies. Just reach out to us and we'd be happy to walk through completing that tab.
Okay. And then we had a follow-up to a question on the red tab that they're referring to. They're actually referring to the last tab on the template, which I believe is the targeted case management tab.
Yes, that is correct. So that tab would be for any of the targeted case management agencies only.
Okay. And that is all the questions that we have here.
Thank you so much, Brianna, for facilitating that question and answer portion. And thank you to Hilltop for taking the time out of their day to walk us through all of this. We appreciate everybody's time logging on here and hope that everyone has a great rest of the day. If people do have any additional questions or just need a refresher on this, this webinar will be posted to the DDA's YouTube as well as their website. And then if any additional questions or technical assistance is needed from there, please reach out to Hilltop. They're more than happy to assist. Their email, once again, is dda_rate@hilltop.umbc.edu. And all of these links will also be on the PowerPoint under the handouts tab of today's webinar. And I hope everyone has a great rest of your day. Thank you so much for joining.